Dr. Kevin Kavanagh is a retired physician and also founder of a national organization called Health Watch USA. We call him Dr. K. Good morning, Dr. K.
Good morning, Jack.
Got breaking news. It just came out 30 minutes or 45 minutes ago involving the Johnson & Johnson vaccine product. Can you give us the latest on that? That's the one-shot vaccine?
Yes. And this, I think, is fairly good news. It is 66% effective in preventing moderate or severe cases and 85% effective in preventing the severest of cases that would put you in the hospital. And I think this is very good because remember, this is just a one-shot vaccine. And they are looking at what it would do with 2 doses. But if you can remember from the other vaccines, and this isn't being talked about much, but the other vaccines, Moderna and Pfizer, if you just get one shot, they were saying, well, it's maybe a little over 50%, 52% effective. So if you put that into the equation and comparing these, Johnson & Johnson may actually have a better product. You just may need to get a second dose or a booster. And to me, I think that that's something that you should really look at if you can't get the other 2 vaccines. Johnson & Johnson is also more stable, can be stored in a refrigerator, so it's much more easier to distribute.
And in the U.S., if you just count the U.S., not worldwide, the efficiency rate is 72% for this Johnson & Johnson product. I think Africa, some other areas in the world that bring the efficiency rate down to 66. But so yeah, I'm with you. I think it's very encouraging, and I don't think it requires that extremely low temperature to be effective either, does it?
No, it doesn't. It can be stored in the refrigerator. And so that's what I said. This is very encouraging news. I think it's much better news than what the vaccine pundits on TV are playing it out to be, because one dose, 72% effective with the variants that we now have in the United States is really impressive.
And we have both the UK, which is United Kingdom, by the way, not University of Kentucky. We have both the UK and the South African variant now in this country, right?
That's correct. And also the Brazilian variant, unfortunately, popped its head up in Minnesota. None of these vaccines have a very, very high efficacy rate against the South African or the Brazilian variant, but they do some good, meaning it may provide you 50% protection. It may prevent severe cases, and that's what it looks like they will do. How long that immunity lasts, we're not sure. But both Moderna and Pfizer are working on a booster shot to specifically address those variants. So if you go the route of Pfizer or Moderna, you're looking at 3 shots right now, as opposed to 1 shot. And as you know, Jack, I'm very shot adverse, so all of this is bad news for me, another shot.
That's right. Let's go to the phones. 253-5959 is our phone line. It's also our auto tech service text line. And let's see here. This is Jim. Hey, Jim, good morning.
Yes, sir, to both of you. I've been listening, what you're saying about things, and I was wondering, there's a couple of things. You said it enters your body through your nose, attaches inside your nose. That's what I understand?
That's correct. That's the most common way. It can enter through your eyes also, but that goes down into your nose, so.
Is there any kind of spray that you could spray up in your nose, maybe it would kill the germ?
There is not at this point anything approved for that. Ideally, you would want to have a vaccine that you could actually just inhale, not get a shot. Of course, you're hearing that from someone who's shot adverse. And that would provide you probably with more protection of being a spreader or an asymptomatic carrier of this virus, because the vaccines currently prevent the virus from spreading in your body once they reach the bloodstream. They kind of have a free pass in the nose because they don't make IgA antibodies. And whether or not that viral titer in your nose will be high enough to spread, we just don't know.
Well, one other thing, all these shots are coming up with, are they really taking the time to analyze them and go through a series of steps to make sure that they're not going to be down the road a lot of side effects from them?
Well, I can tell you there's probably less side effects from these shots than from the virus. That's number one. You have to realize the Pfizer and the Moderna vaccine have been developed over the past decade, primarily for MERS and SARS. It was then tweaked for our current type of coronavirus. And these new strains coming out are just tweaks. That's similar to what happens with the flu vaccine. You don't have randomized controlled trials on every time you get a flu vaccine because all they're doing is just changing one or two little areas of that genetic code or in the protein in order to get a new vaccine. So you can't have a double-blind study with a virus that's mutating this fast.
One little question along with that question, does China, do they have a vaccine for what they invented? You know, they made this thing, so do they have anything they've worked on that may be a vaccine?
Yeah, I'm not sure the etiology of the virus, but they are working on a vaccine. And from what I've seen, their vaccine is not that effective. It's about 50% in testing. So no, they didn't. And that's one of the big strikes against the theory that this was some sort of bioweapon released, because they don't have a vaccine at this point that is highly effective, at least not as effective as Moderna's and Pfizer's.
Okay, thank you, Jim. Let's check a text here from our Auto Tech Service text line for Dr. Kavanagh. Ask Dr. Kavanagh, is there anything about Advil and Tylenol not being used after getting the COVID vaccine? Have you heard anything about that?
I have not heard anything about that. I know that at some point there was concerns on that it may make the virus worse, but I don't think it's going to affect your immunity to the virus once you get the vaccine. I have not heard any advisements on that. I've seen the instructions post-vaccination. No one said don't use Advil or Tylenol. So I would follow the directions of your physician, and I would just go with what is stated on the instructions.
Now, you have some information about Noravax's vaccine.
Yeah, Noravax has another vaccine which is coming out, and this is a United States company, and it looks like it is going to be very stable and very good, and it also has an efficacy rate of about 89% against our current variants, and that's the D614G variant, which was the one we had for the majority of last year, and also the UK variant. However, when you get into the South African variant, its efficacy does drop to around the 50% to 60% range, and so it is less effective with that. And this is a big warning flag, because if we keep spreading these viruses around, they're going to keep mutating, and we're probably just one or two iterations away of this virus actually evading our vaccines. And as I've said before, we can easily go out there and produce another one for that virus with our current technology. And this is good news, but it's a lot harder to revaccinate everybody in the United States.
Dr. Kavanagh, we got a couple of, actually 3 texts to get to. I have read that COVID-19 is not as severe for those that have asthma as it is, or as it was thought to be. Do you agree with that? It's not as difficult on people with asthma as it was thought to be. What's your response to that?
Well, I still think if you have asthma, you're going to be in a higher risk category. I'm not sure the studies would show if you're as great a risk as they once thought, but certainly the greatest risk for COVID-19 is, number one, if you are obese, that is severely problematic. And number two, if you are elderly, in other words, above the age of 65.
Now, this is from Todd, and Todd makes a great point. He says lots and lots and lots of talk about vaccines, but why isn't anyone in the medical community talking about taking care of yourself, losing weight, eating better, and exercising? These are the things that make your immune system better. Is that valid? I think it is.
Well, I think it is, yes. And some of the research has shown that when you're overweight, it's just not a risk factor because you weigh more and there's more strain on your heart, etc. But it actually does have something to do with your immune system. And so, yes, they really do need to look at that, because many of us have put on COVID pounds. I've gained approximately 7 pounds, which isn't good, and that's been over the last year. But that's what happens when you're cooped up with your wife and she is just an excellent cook. It's hard to keep from eating. And of course, you have reduced exercising. And so all of that's problematic, and people do need to get out. They do need to exercise. But remember, when you do that, you still need to wear a mask and you still need to social distance.
Here's another text from our Auto Tech Service text line. By the way, you just made some points with your wife. Good for you, Kevin. This one says, I have rheumatoid arthritis and do not take any autoimmune drugs at all. Should I get the vaccine? My immune system is already overactive.
Well, I would definitely talk to your doctor about that. One of the problems with getting a vaccine out so quickly is that although you know for the general population in the average case with a high degree of accuracy whether or not it's safe, when you start to look at specific groups of patients, such as if you've had a transplant, if you've got rheumatoid arthritis, if you have lupus, all of those haven't been extensively studied, and your doctor may know more and have more up-to-date information than what I do.
All right. Now you say that Merck has sort of thrown in the towel on the vaccine, huh?
That's correct, and that's to be expected. Remember, we didn't think that we'd even have 2 out of the gate this quickly being effective and approved for the administration of the vaccine. And right now, it looks like Johnson & Johnson is probably going to also get approval. So we have a lot more coming out than what we thought we would have, because usually the vast majority of products that are being researched and developed never come to market. They're not proven to be effective. So we're actually in a much better situation than what I would have predicted back last spring.
Were you surprised that Merck pulled out? I know they've probably spent an absolute fortune.
Well, I was. And of course, some of that is offset by government grants. But one of the things that may happen is they may repurpose their manufacturing capability into making the other vaccines. And they're looking at what that's going to take to be able to do that, because that would be a huge advantage in getting vaccines out and getting them into the arms of people.
What that means is they would be making vaccine, but they would be making someone else's products.
That's correct, yes.
Okay, here's a couple more before we run out of time. We're getting close. This is from Bill. How long after you ride out your isolation period after testing positive can you still test positive?
Well, it can be up for several months. There have been reports up to 2 months, and this is because you can have a lot of dead viral RNA within your system that, although it's not a pure virus and it's not an active virus, it still tests positive. Kind of like on Jurassic Park, where they find the dinosaur DNA in the amber. It's not a dinosaur, but it still tests positive.
I see. Irvin says, I heard a virologist say that a stronger immunity is created at a higher temperature, therefore Tylenol and ibuprofen should be avoided after getting the vaccine. So I guess that's where that came from, but my guess is that you'll research that and get back to us on that on Monday.
Yes, I think so. As I said before, I'm not sure about that one.
I will tell you this, there's nobody that works harder at doing this program than Dr. K does, and anytime a question is asked that he doesn't immediately have the answer for, you can bet your bottom dollar he's going to be researching it and have it for you when he's on again. Okay, so we've got just a minute or two left, and so we don't want to get into too many complicated things, but what is your message for folks going into the weekend?
Well, I think with these new variants out, the UK and the Brazilian and South African, we've got to be very cautious to make sure that we're following public health advice. And that's wearing a good mask, one that's well fitted, many layers. If you don't have a good mask, put on 2 masks. And you want to have it fitted and tight enough around your face that you're not breathing out of the sides. If you're into an area that has a lot of different individuals and you're going to have a lot of contacts, consider wearing a face shield or goggles on top of the mask. And I know this is different than what we were saying before, but we are looking at different variants of this virus now. You also need to remember that our genomic testing, in other words, testing for the variants, is behind most of the world, and it takes us weeks to get back the results. So that when we find 2 variants in South Carolina, that's probably what was taking place a month ago. Right now, there's a lot more community spread of that, and we really do need to start to protect ourselves because we have the tools, we have the knowledge, We have the vaccine. We can kill this virus dead if we just get everybody on the page to wear masks, social distance, and follow public health advice. And when the vaccine gets available, please get the vaccine.
Bill, who asked the question about how long can you test positive after, when you've already had it, and you said 2 or 3 months, he just wants to know real quickly, during those 2 to 3 months, are you still contagious or not?
You should not be contagious. And this is why the CDC has their advisement that if you have mild COVID, 14 days after initial symptoms, you're usually not contagious. Likewise, severe COVID, that goes to about a month.
All right. Thank you, Dr. K. We'll talk to you on Monday. Have a great weekend.